Hey, welcome back to my channel. I appreciate you stopping by. Just want to talk to you a little bit about today's City of Memphis, Shelby County COVID-19 Commission's reporting that they did. The Shelby County Health Department Chief Epidemiologist David Sweet gave a good effort trying to put the COVID deaths into context by comparing the leading causes of death and placing those COVID numbers within the context of the 2020 and 2019 deaths. I would have preferred to see him put a little bit more detail into that, and here's what I'm talking about with that. When you look at the death reporting, he pointed out that the COVID deaths were the third in line after cancer and heart disease issues, and I'll put the link for that briefing below. But he showed the number of 903 COVID deaths for 2020, and then he showed a 10.25% makeup of all the deaths within 2020 as a reporting. Well, that number would give you a number of 8,810 deaths for 2020 if that number is accurate. Now, let's put that into a greater context so that way we don't look at all these big numbers and get all scared, because that's what we've been seeing a lot is big numbers being reported over a 10-month, 11-month period and not putting it into the overall context of what do those numbers mean. For example, if we were to look at that 8,810 deaths for 2020, for a population of 937,967 people within Shelby County, that's a 0.9%, not 1, but 0.9% death rate for the population. Well, then you go back to 2015, and you'll see that every year it has been a 0.9% death rate. So regardless that we had an increase over the last 3-4 years since 2017, where we've had 141 extra deaths as compared to 2016. 2017 we had 8,270 deaths. 2018 we had 8,528. 2019 we had 8,723. But again, compared to the populations, last year, our 2019's population was 937,166 people. The year prior, in 2018, that was 936,365. 2017, 935,251. And I'll have all this information in the notes below. But again, you have to look at those numbers and then put it into the greater context. Well, we're not getting that if you're just looking at these big honking numbers of 900 people have died. Well, at 903 people that have died, if you remember from my previous video, the vast majority of those folks, over less than 99 of those people, are below 55 years of age. Everybody else has been 55 and above. And a lot of those deaths were in nursing home and critical care type facilities, hospice care. And again, you've got to put that in the context of most folks that go into assisted living or nursing home facilities usually have, sadly, a life expectancy of about between 2 to 3, maybe a little bit more years. But outside of that, especially when you get into hospice care where they're already at, like, whether it's a stage 4 cancer or they're in a quickly diminishing health capacity where you have anywhere from 3 months to less than a year of expected life expectancy, those are numbers that really don't get flushed out when you just look at 903. 903 is a bad number, but so is when you start looking at the people that were murdered last year. We had 332 people that were murdered last year in Memphis. That's a bad number. If you look at 2017's number for murders, for example, we had 180. 2018, we had 186 plus 6 people. 2019, we had 191 people that were lost for murders, plus 5 people. 2020, we had 332. Again, I say that again. That's a plus 141 number of people that were killed. 74% increase of murders last year. Now, and if you read the Commercial Appeal recently, you realize that only about 56% of those cases have been solved, which means 46% of those crimes have not been solved as of yet. Now, what I would have preferred to see Mr. Sweet actually explain is why bed capacity within Shelby County has been steadily decreasing. As I noted again in a previous video, the bed capacity within Shelby County in 2004, now again, this is 16 years ago, was 3,195 bed capacity. Since then, since up to 2019, that number has dropped by 25%. To where we now have a bed capacity being reported to the state of Tennessee of 2,556 beds, and that's acute care and ICUs. Now, the study that I referenced in the previous video highlighted that was mainly because of economic reasons. However, now let's look at 2020. On July 19th, the bed capacity that was reported by the health department through the HERTS, the Healthcare Resource Tracking System, was 2,873, with acute care beds being 2,437, and ICUs were at 436. On December 21st, bed capacity dropped again about almost 100 beds to 2,785 capacity, with 2,338 of those being acute care and 447 being ICUs. Now on December 30th, bed capacity again dropped to 2,777, with acute care beds being about 2,340 and ICUs still being around 437 beds. Again, a drop of ICUs by 10 beds. Now, as of January 4th, the bed capacity decreased once again to 2,719 beds, with acute care capability of 2,301 and ICUs down to 418 ICU beds. That is a concerning number. That is a number that needs to be explained. Now, part of that could be, as I've heard from friends, where that could be traveling nurses that have found better opportunities elsewhere. That could be, as some of my friends and my wife's friends have mentioned, that there could be nurses that are fed up with administrators. But again, that's anecdotal. And anecdotal doesn't answer the question of why. And the health director, as well as these hospitals that can provide that information, should be providing that to our local officials, so that way we still have the confidence in what our government officials are doing. Now again, I stress to everybody, please do the right things, do the social distancing if you can, take all the precautions, wash your hands, be hygienic, wear the mask if you're out there. And again, there's people that agree and disagree about the efficacy of the masks. I've seen the studies myself, and I do question some of the logic of it. But again, it is a requirement. It's not that hard to put a mask on when you're out in social settings and you can't do the social distancing. Again, even though you may not have COVID, does not mean that somebody else does not have it. And again, part of the spread of COVID is through the aspiration of basically droplets that are coming from a person's mouth or nose, and it has to enter your mouth or nose. So if you've got the mask on, it's going to give you some level, not a guarantee, but it's going to give you some level of protection. So again, it's a pain in the butt, I agree. I think that our health officials have done a piss poor job of communicating effectively. I'm glad Mr. David Sweet has at least made a first good faith attempt at trying to put things into context. I'm going to give them the opportunity to hopefully answer some more questions. And I'd really like to see our reporters and journalists and other government officials. My county commissioner has done a great job of asking some of the questions I've asked of him to ask them. So Commissioner Mick Wright, I do appreciate that. I would ask the other county commissioners to give the health director, yes, all the praise that they deserve, but at the same time, hold them accountable for the decisions they're making, because there's no transparency, absolutely none. I have yet to see a decision support template or have any kind of rational explanation given to the public. You can tell me that you've given it to elected officials all day and twice on Sunday, but the public is the one that has to have the buy-in as well. And if they don't have it, they lose the faith in the system, and that is not something good for anybody. So again, I hope everybody's doing well. I hope everybody's having a better new year, and I hope that we get through this in a timely manner. So be safe out there. Best regards as always, and thank you again for watching. If you got questions, please put them in the comments below. Tell me what you think. Has the health department actually done a good job of providing you accurate information on what's going on? Do you think that the numbers are skewed or they're not being put in proper context? Please let me know. Thank you and have a wonderful day.